Here are my disclosures, and I'm going to, my full disclosure is I thought I had a 20-minute talk, so I'm using my cheat sheets so I don't go way over. So there we have, that's my big disclosure. Right, Brenda? So we're going to canter through a few things, the MOA and treatment. I'm going to give you a sneak peek of some safety, immunogenicity, and clinical data. And then really like what Adam had done this morning and many of my colleagues here in looking at some of our data, we've answered some questions, but we've got more questions that we need to answer as a result. So I'm going to, hopefully that'll come up in the panel discussion. So many of you guys have seen this, and I know Ed Gain and Grace Wong have presented this before, but just as a sneak peek and a bit of background, Virion 0200 is a novel immunotherapy being developed for, of course, HBV functional cure. It contains optimized core and Pol antigens that's pan-genotypic, so covering A through D, and a genetically encoded checkpoint modifier, which is glycoprotein D, GD. So again, just a note, when you're looking at these data and data that we're going to share as a late breaker at AASLD, just remember that we do not target S. So again, just keep that in mind when you're looking at the data. We've got two heterologous distinct chimp adenoviral vectors, each of the from ADC6 and ADC7. And we're administering them intramuscularly through our study. So here, and I'm going to just click it through to speed things up, and give away raise the curtain. So this cartoon shows a brief overview of the MOA. And again, swing by and see us on Monday afternoon if you'd like to get more data, and we have more on our website as well. But for the 10-minute presentation, I'm just going to zing through. So again, where we start, and I know the pointer doesn't work, but following the IM vaccination, the core and Pol antigens are presented to the T cell for activation. Then what happens, the glycoprotein D, it's the fusion protein, it acts as a checkpoint modifier. So that's a little bit different because what it's doing is a couple things. It's actually inhibiting the key inhibitory signal of the T cell activation, so the BTLA. But what this also then does, it allows for increased T cell receptor signaling via light. So what happens then, it actually allows it to bind to a different location, the HVEM, and allows co-stimulation. So again, different. That's why we're calling it checkpoint modifier. So again, on the right-hand side of the slide, there's some key things. It actually amplifies the T cell response. It actually broadens the T cell response because it's actually lowering the activation threshold. And then, of course, the new ones, they use up less energy, so in fact, it limits T cell impairment. And then again, and this was asked of me just before this talk, is that because it's intramuscular and it's targeted, it's not systemic, so it mitigates safety concerns as well. So that's the MOA and the preclinical. So again, I'm not going to go through this, but the key thing, and this was something someone else coined for us, so I can't take credit for it, but it's this new 2-in-1 treatment approach, or that's how we're thinking about it, on this removing the brakes and hitting the gas, hence checkpoint modifier. So Ed is here, and he presented some of these data at EASL, so I wanted to give you this framework, and again, to tempt or tantalize you to come to Grace and Ed's presentation on Monday afternoon. So again, just so you know, the study schema thus far is we've got 3 cohorts, in fact, and this is showing 2. But what we have done is there's a low-dose cohort for cohorts, which is cohort 1 that we'll be showing you, and they're randomized to prime and then you get prime only, so one injection, IM injection, or prime boost with that's at day 90 for that group. And what we're going to, and group 2 is the same. It's just a higher dose, so higher VP per IU, and for vaccination. But for this study, and what you'll see here at AASLD, we're showing it, and we're just limiting it to the prime only. And why is that? It's that we have more data and more mature data from our cohorts 1 and 2. So again, just keep that in mind. It's one shot, one IM injection that we're going to show you. And again, on Monday as well. Inclusion criteria, nothing crazy about this. The one thing I do want to note is the surface antigen less than 500. So that was the inclusion criteria, but everything else is pretty standard fare. This is all of the folks that were included were on nukes. This is again from EASL, the subject disposition of 13. So again, we've got good follow-up on this group. And what I can tell you is, again, a sneak peek is that we've got 800, just under 1,000 on treatment days for patient safety days here. What we'll be presenting on Monday is close to 5,000 patient days now and an N of 25. So stay tuned. Again, I'm just getting you excited about it. So of course it's a phase 1B, and what are some of the things that of course, our primary endpoint is safety and tolerability. So again, with our cohorts here for cohort 1, an N of 13, it was extraordinarily safe as it shows here. We had 5 grade 1 AEs in 3 patients, and again, standard ones that unexpected. They were all resolved, no discontinuations or anything. And as many of us know, you get a little bit worried when you see safety that's so good, because then you think, is there any activity at all? So, just before I go into the next, our secondary endpoint was immunologic assessments. I just wanted to let you know kind of what we were looking at. And we have a very robust, and again, thanks to Adam and some other colleagues on developing our PBMC protocol. I know more about liquid nitrogen than I ever wanted to, but that's a whole other story, and I needed hours, maybe over the networking reception. But nonetheless, we've got extraordinarily robust data for PBMCs. We've been doing it pretty much, air quote, real time for our study. So again, we're going to be showing the first immunologic assessments for this here. And I'm pleased and proud to say, even as of this moment, and Ed knows this and others, that we have 100% of all our patients, we have been able to do analyses, PBMC analyses. So it's phenomenal, thanks to our studies and study teams. So this is showing you, again, this is EASL data that you may have seen, and again, we'll have more. We'll have it on 22 patients on Monday. But just to give you the overall, and how we did it is that, so we had 2 pre-treatment PBMC responses. So we didn't have a single time point. So what we did is we wanted to see, was there a blip or diversity in the data? And as you can see, the pre-treatment responses, days minus 28 to minus 7 and day 1, that's pre-treatment. And so again, you can see what we did is looked at and compared and considered a response at day 20 that they had to, day 28, they had to be above the responses of the pre-treatment responses. What you can see here is all comers, the first 9, at day 28, there was 2.4 times response for interferon gamma. And when you looked at the participants that were, again, what we were calling responders, in that group, it was 4 times the interferon gamma responses at day 28. So again, that got us very excited. That was our secondary endpoint. So you're wondering, where are we going? And on Monday, again, Drs. Wong and Drs. Gain will be presenting this. And the title, which will be out on Friday, the title is giving you a hint of what we may show. On Monday, Grace and Ed will be presenting and sharing some of the data for anti-HBV activity on Monday. So we're hopeful that you'll come to that. The other thing, too, in looking at what the data is coming is we just wanted to share where our study is going. We have had, we are almost fully enrolled in our cohorts 1 and 2. And cohort 3 is a new cohort that's now currently enrolling, and it's in combination with VIR 2218 and VIR 3434. And what that is just specifically is, and it's on clinicaltrials.gov, but it's our prime only. So you're randomized like our other cohorts, and it's prime only for Virion 0200, followed by at the month 1 or at day 28, then the monthly sub-Q bundle of 2218 and 3434 for 6 months. And then the folks that are randomized, then they would get the Virion 0200 boost 1 month thereafter. So again, that's just enrolling, just recently started enrolling. So again, sneak peek, come by the poster, the presentation of Grace and Ed on, but you can see, I'm teasing you, blue boxes, just suggesting, swing by. We're excited and actually surprised at the early results that we're going to be sharing. So in conclusion, and just again, what we're seeing is first checkpoint modifier vaccine of this time, and again, checkpoint modifier, that's what differentiates it. I won't go into any of the things, but again, it's IAM. The data we're sharing right now is prime only, extraordinarily safe, and it does though, and I don't know if I have, Brenda, do I still have, I have, oh, I'm over time. Drat, I blew it. But I'm going to leave questions for this group that we can talk about, and I'll let Adam and MF bring it up. But more questions than answers, and I'm hoping we can talk about it at the panel. Thank you, guys. Sorry about going over.